Sian Griffiths is a leading public health expert who chaired Hong Kong's inquiry into the SARS outbreak, and she's currently the chair of Staffordshire University's Centre for Health and Development. And I'm delighted to say she joins us now live. Thank you very much indeed, Sian. So we've just heard the Prime Minister calling for vigilance. With people being vaccinated, are you concerned that people are starting to take their foot off the pedal?
Well, we have seen the most remarkable vaccine rollout in the UK, across the whole of the UK, with very high numbers of people coming forward. And now we're down to inviting the 55 to 60-year-olds to the community hubs, to the general practices, and to the vaccine centres. So that has all helped to get the immunity in the population pretty high, because we've also seen the research showing that the AstraZeneca and the Pfizer vaccines do produce an antibody response that is over 60% in the first few weeks, going up to 90% over a longer period of time, particularly once we have the booster at 12 weeks. So I think what we're seeing here is we're seeing a highly immunized population, and that does tend to lead to a certain relaxation. And I think the Prime Minister there is underlining his message that we are on a route map out. We have, first of all, started today with the schools going back, and primary school students don't need to wear masks, but of course there are other regulations such as testing and mask wearing amongst secondary pupils. And then we continue, there'll be close evaluation of this. There is some expectation that the numbers will increase, but there'll be close monitoring, and particularly for any variants, because variants, as we saw at the beginning of December in the UK, when the Kent variant took off in the southeast of England, we have to really watch that we don't get any more variants in the population and the case numbers start to increase. So, but if we get to April the 12th and things are going well, then we'll go into the next phase of the lockdown, where shops will open again. And then come May, if things are still going well, we'll be going into the, considering whether we can go abroad for holidays, as well as people will be able to stay in at each other's houses in limited numbers. And then in June, we'll expect to see the whole of lockdown restrictions released. So that's the pathway. But it does rely on people sticking currently to the stay home message, continuing to work from home. And although the children have gone back to school, it's a matter of slowly and being thoroughly monitored so that we're absolutely aware of which way the cases are going. And hopefully things will go well, particularly since it's warmer weather, we can be outside more, ventilation isn't such a problem. So it's at the current time, I think people are feeling more optimistic than we were feeling. Our numbers, the case rates are going down. They are still high, considering that we should be aiming to get them really as low as possible. Hospital admissions have gone down, and the death rate is below 100 for the second day today. So slowly and carefully, we may be able to release this lockdown.
Professor Sian Griffiths, thank you so much for your time.